I'm Dr. Abeyna Jones, reporting from the Grand Connaught Rooms in London, and this is our second Alternative Careers and Wellbeing Conference for doctors. So this year we've got an evening social called Diversify Your Career, and we have got the eminent, entrepreneurial, and slightly different Professor Tony Young, also called the Plumber from Essex, and he will tell us why he's called the Plumber from Essex. So, please tell us why you called the Plumber from Essex.
What an introduction. Thank you, Abeyna. But I'm also the Director of Medical Innovation at Anglia Ruskin University and have helped deliver a £500 million investment for our Medical Technology Science Park going up. And of course, I'm also the National Clinical Lead for Innovation at NHS England.
Okay, so how did you land that job?
I asked myself that question. I think they probably made a mistake, actually, and they've realised it, but it's too late to change the things. No, really, I think there aren't many surgeons who've done 4 startups. We're also an academic, had also done some healthcare innovation and change. So I think when they were looking for a lead for innovation at NHS England, it was difficult to get someone with a sort of a varied career and a mix that had incorporated lots of different things. And although I've been a full-time surgeon and trained as a full-time trainee, I did lots of other things alongside that. And I think probably it was that did it, as well as delivering on things, rather than just, sometimes people talk big, then they pitch, they come up with lots of great ideas, but it's actually delivering time and time again. And I think I've been fortunate enough to be able to do that.
So tell me, obviously you pushed against the grain for the majority of your career to embark on some really interesting projects and entrepreneurial pursuits to actually get to the position that you are now. What really motivated you through those times?
It's all about making a difference. It's I don't want to be the richest man in the graveyard. I want to be the happiest one. So I see. Sometimes you see 6 billion ants going in one direction on the planet, and I'm one of the ones going the other way, going, you've all got it wrong. And I think entrepreneurs are like that, aren't they? Entrepreneurs are people who are restless, who want to do things in a new, in a better, in a different way to improve the lives of those around them. So I suppose the fundamental thing that drives me is wanting to make a difference and have an impact on people's lives, not just in my hospital or my county or my country, but actually right across the planet. And if you're an entrepreneur in healthcare, you can do that.
Okay, thank you. And finally, what advice would you give to doctors who are considering starting up their own projects, doing something different that's not conventional training or prescribed in the NHS?
Don't give up. Have a go. If it's entrepreneurial, come and join the Clinical Entrepreneur Programme at NHS England, as you have done. I would... you can always get in contact with me. You can connect with me via LinkedIn. I'm always happy to help and advise or connect you with the right people that will do that. But persistence is a key thing. Resilience, you've got to keep going. It's not I went against the grain. I actively fought the system for much of my time in life. What I was trying to do, set up companies and take things forward. I was fundamentally trying to improve patient care, but the barriers that were put up, the negativity I got, the just no all the time was a real problem. But as anyone who knows me will know, I don't generally take no for an answer. And I love Richard Branson's phrase, which is screw it, let's do it. And I get on and do it, try and bring as many people with me as I can and apologise later. But if you've got the patient or our workforce at the heart of everything you're doing and how you're trying to transform things, then I think you can't go far wrong.
Thank you very much. So there you have it. NHS Innovations is not quite an oxymoron, as someone once put it. But thank you very much, and we look forward to your talk later on today. Thanks.